Have you noticed yourself going to the bathroom more often than usual? Sometimes every hour during the day, or waking up 2 or 3 times a night? At first, you might think it's just because you drank too much water, or maybe it's part of aging. But urologists warn that frequent urination can sometimes be an early sign of problems with your kidneys. The kidneys do far more than just make urine. They filter waste, balance fluids, and keep your blood pressure stable. When something isn't right with these vital organs, your body often shows changes in urination long before other symptoms appear. Ignoring those signals can mean missing the chance to catch kidney disease, infections, or stones at an early and more treatable stage. In this video, we'll explore the connection between frequent urination and kidney health, the causes urologists look for, and what steps you can take to protect yourself. The kidneys are 2 bean-shaped organs located in your lower back, and though they may seem small, their role in keeping you healthy is enormous. Every single day, your kidneys filter around 50 gallons of blood and remove excess fluid, toxins, and waste products through urine. They also help balance electrolytes like sodium and potassium, regulate blood pressure, and even support the production of red blood cells. When your kidneys are functioning well, urination follows a fairly steady pattern, typically 6 to 8 times per day. But when something begins to interfere with kidney function, one of the earliest warning signs is often a change in how often you need to urinate. This can mean more frequent daytime trips, waking multiple times at night, or producing either unusually large or unusually small amounts of urine. Urologists often describe frequent urination as the body's signal that something deeper may be happening with your kidneys. For example, if the kidneys aren't filtering properly, excess fluid may build up during the day and then flush out at night, causing nocturia. Or if the kidneys are irritated by infection, stones, or high blood sugar, the bladder may respond with urgency and frequency. The key message from urologists is simple. The kidneys and bladder are closely linked, and when urination patterns change, it's worth paying attention. Early recognition of these signals can lead to timely treatment, preventing complications and protecting long-term kidney health. When men and women come to a urologist complaining about frequent urination, one of the first areas doctors investigate is kidney health. That's because the kidneys play such a central role in filtering blood and producing urine. And when something goes wrong, the bladder is often the first place symptoms show up. One common cause is a kidney infection, pyelonephritis. This usually starts as a urinary tract infection that travels upward. Along with frequent urination, patients may notice fever, chills, back pain, or burning when urinating. Left untreated, kidney infections can cause serious damage. Another frequent culprit is kidney stones. Even tiny stones irritate the urinary tract, leading to urgency, frequency, and sometimes blood in the urine. Larger stones can block urine flow, causing severe pain and the need for urgent treatment. Chronic kidney disease, CKD, is a more gradual condition. As the kidneys lose their filtering ability, patients often notice changes in urine volume, sometimes producing too much, sometimes too little. Frequent nighttime urination, or nocturia, is especially common in early CKD and may appear years before other symptoms. There are also inherited conditions, like polycystic kidney disease, PKD, where fluid-filled cysts enlarge the kidneys and interfere with normal function. PKD can create frequent urges and reduce bladder capacity over time. Urologists emphasize that while frequent urination can come from harmless factors like drinking excess fluids, it can also be the body's way of alerting you to infections, stones, or progressive kidney disease. Recognizing these causes early and treating them appropriately makes all the difference for long-term kidney health. When a patient comes in with frequent urination, a urologist doesn't just focus on the bladder, they immediately consider the kidneys as well. The first step is always a detailed conversation. The doctor will ask when the problem started, how many times the patient urinates during the day and at night, and whether there are other symptoms like pain, blood, swelling, or fatigue. These clues help the urologist narrow down possible causes. Next, they perform a urine test, urinalysis. This simple test can reveal blood, protein, sugar, or signs of infection. Protein in the urine, for example, may suggest kidney damage. Blood could indicate stones or infection. Blood tests are equally important. A creatinine test and an estimated GFR, glomerular filtration rate, show how well the kidneys are filtering. High creatinine or a low GFR is a red flag for kidney disease. Urologists may also check blood sugar, since uncontrolled diabetes is one of the leading causes of kidney problems. Imaging tests come next if needed. Ultrasound helps detect stones, cysts, or blockages, while a CT scan can provide even more detail. In cases of recurrent infections, urologists may order specialized tests to see if urine is backing up from the bladder into the kidneys. Finally, the urologist looks at lifestyle and medical history use of medications, high blood pressure, salt intake, or long-term use of painkillers, all of which affect kidney health. This thorough evaluation allows the doctor to distinguish between harmless causes of frequent urination and those that signal deeper kidney issues. For patients, it means peace of mind and a clear path forward. Once a urologist identifies what's behind frequent urination, the next step is protecting both kidney and bladder health. The good news is that many of the strategies are simple and can be applied right away. The first priority is hydration. Drinking enough water helps flush out bacteria, prevents kidney stones, and supports healthy filtration. But balance is key. Too little water strains the kidneys, while too long, especially at night, can worsen nocturia. Urologists often recommend steady hydration during the day and cutting back a few hours before bedtime. Diet plays a huge role as well. A low-salt diet reduces fluid retention and blood pressure, both of which protect the kidneys. Limiting processed foods, alcohol, and excessive caffeine can reduce bladder irritation and lower strain on the urinary system. Including more fruits, vegetables, and whole grains supports overall kidney health. Blood pressure and blood sugar control are critical. High blood pressure and diabetes are the two leading causes of chronic kidney disease worldwide. By maintaining healthy numbers through lifestyle and, when necessary, medication, patients can significantly reduce kidney-related complications. Urologists also caution against the overuse of painkillers such as NSAIDs. While useful for short-term relief, long-term use can damage kidney tissue. Patients with frequent urination are often advised to review their medication habits with their doctor. Finally, exercise and stress management make a difference. Regular movement improves circulation, helps maintain a healthy weight, and reduces the risk of diabetes and hypertension. Stress management techniques, from meditation to deep breathing, can help calm an overactive bladder. Together, these lifestyle changes not only reduce frequent urination, but also provide lasting protection for the kidneys, ensuring they continue to filter and balance the body effectively. Frequent urination may feel like just a daily inconvenience, but urologists remind us it can also be an important signal from the kidneys. Infections, stones, chronic kidney disease, or even lifestyle habits can all play a role. The key is not to ignore the signs. By paying attention early, getting the right tests, and making healthy changes, you can protect your kidneys, improve your bladder comfort, and safeguard your long-term health. The good news is that many causes of frequent urination are manageable, and in some cases, completely reversible with the right care. But it starts with action. If you notice persistent changes in urination, especially when combined with pain, blood, swelling, or fatigue, don't wait. Consult a urologist and get clarity. If this video gave you valuable insights, please like, share with someone who may need it, and subscribe for more trusted health content.